In order to do this, we want to bring the patient a little bit closer to the edge of the mat because we're going to need to be able to stand between her legs. Then we're going to put her sky side iliolumbar ligament on slack table in between T8 and the segment that we're treating. Once we've got her there, then I'm going to side bend the table up to get her in that side bent position and put that iliolumbar ligament on slack. Ultimately, I'm going to get her to rotate in that same direction and therefore relatively lock the lumbar spine. However, prior to that, I want to put myself in the position so I can control her leg position. The sky side or involved side's hip needs to be ultimately extended, so we're going to flex forward the lower hip and then stand between the legs this way. Now, I'm not going to step up high into the legs at this point because if I do so, then I will have the tendency to posteriorly rotate the pelvis, which I don't want to do. Prior to stepping up into the legs further, I'm going to cradle her sky side leg with my treatment forearm over the iliac crest, clasping the hands. I'm going to take up all the slack in hip extension. At that point, I'm going to now ask her to rotate back, and she can even hold on to the edge of the table. I keep her sacrum vertical. Now, with her end range extension, I can step up into her mat side leg, creating more hip flexion. I can go as far as I begin to feel the pelvis rotate posteriorly. Then I step back, tighten it up further. In this position, I am now going to perform the high velocity thrust technique, whereby I rotate the sky side pelvis in an anterior direction, thus promoting counternutation in the joint. I'll step up, take up all the slack, ask her to take in a breath, let it out, and then apply overpressure. I let off slowly, bring her hip back to neutral, step out of her legs, and let her relax.